Are you taking 3 blood pressure medication and your blood pressure is still high? That may be resistant hypertension. If your blood pressure stays high despite treatment, your body may be sending an important warning sign. Some people don't have regular high blood pressure. They have a harder to treat type of blood pressure called resistant hypertension. High blood pressure that refuses to come down is not something to ignore. Hello, everybody. I'm Dr. PK. Today, let's talk about resistant hypertension, a condition where the blood pressure stays high even though a person is taking 3 different blood pressure medications at proper doses, and usually one of those medications is diuretic or water pill. It also includes people whose blood pressure is controlled only because they need 4 or more medication. This definition is used in major hypertension guidance. I'll give you an example. I had a patient who was on 5 different kind of blood pressure medication for several years. So when I first time I saw him, I couldn't believe that he was on those many medication. I was surprised. His blood pressure was well controlled. But I did tell him that I thought he had undiagnosed, untreated sleep apnea. And he agreed to get a sleep study test done. And he was diagnosed to have a severe sleep apnea. And after that, he tried CPAP. His life completely changed. Now he's on 2 blood pressure medication. Sleep apnea is well controlled and he feels great. So I'll just give an example. Now, this is very important because calling it resistant, doctors often make sure that it's truly resistant and not falsely elevated. Sometimes real problem is wrong blood pressure measuring techniques. In our clinic, sometimes we measure blood pressure 4 times. 2 times always, sometimes even 4 times. Sometimes even I measure it because there's so much variation. Blood pressure varies depending on your stress level. Some people are not comfortable being in a doctor's office and other reasons. White coat effect in the clinic. Sometimes people are they miss the dose. They're in a hurry, they miss their dose, blood pressure is high. Medicine not as strong as should be. Sometimes it could be too much salt in diet. So what causes resistant hypertension? Some of the most common causes include too much sodium intake, obesity, chronic kidney disease, sleep apnea, hormone problem called primary aldosteronism, where the body retains too much salt and loses potassium. Medicine can push blood pressure higher. Certain medication, for example, ibuprofen, pain, some decongestant, stimulant, excess alcohol. One major hidden cause is sleep apnea. A person snores loudly, feels sleepy in the daytime, wakes up tired, has obesity. Doctors often think sleep apnea. Another major hidden cause is primary aldosteronism, especially if the blood pressure is hard to control or potassium is low. So how do we evaluate it? Usually we confirm the blood pressure is high and we ask a patient to do home readings, sometimes 24-hour ambulatory monitoring, review all the medication supplements, check kidney function, potassium, look for sleep apnea, screen for hormone causes like aldosterone excess. Now let's talk about the treatment. Treatment usually starts with fixing the drivers, reduce salt, lose weight, exercise, improve sleep, limit alcohol, stop blood pressure raising medication whenever possible. Okay, and second part is optimizing medication. Okay, doctors usually make sure the patient is on the right 3-drug foundation often: a long-acting calcium channel blocker, ACE inhibitor or ARB. So long-acting calcium channel could be amlodipine, difedipine, etc. ACE inhibitor could be lisinopril, benazepril, or ARB could be losartan, valsartan, telmisartan, and a diuretic, often like hydrochlorothiazide, chlorthalidone, when appropriate. If the blood pressure is still high, then recent European guidance recommends a spironolactone as a preferred next add-on treatment in many patients with resistant hypertension, with eplerenone as an alternative if a spironolactone is not well tolerated. But whenever you put patient on this kind of medication, you have to check for their electrolytes, potassium particularly. If somebody has some mild renal function, it becomes much more important. Resistant hypertension is not just stubborn blood pressure. It may be due to hidden problems, sleep apnea, kidney disease, hormone imbalance, excess salt intake. So good news is that with the right workup, lifestyle changes, medication adjustment, many people can get it under much better control. And remember, uncontrolled resistant hypertension raises the risk of stroke, heart failure, kidney disease, heart attack. So it should never be ignored. Okay, please do not change your medication on your own. Work closely with your doctor, especially if your readings are repeatedly high. Thank you for watching. If you like the video, share it, repost it, ask any questions.